Okay, well, welcome everybody to the Senior Concerns Seminar Series. I'm so happy to welcome you all today to this amazing presentation that we have planned for you. My name is Martha Shapiro, and I'm the Director of Programs at Senior Concerns. And just to give a quick overview of Senior Concerns to those of you who might not be familiar, we run a lot of different programs and services to support seniors in the community. We operate a caregiver resource center. So we have a social worker that can talk with anyone who's caring for an aging loved one. She runs support groups and can also do one-on-one care consultations at no charge if you just give us a call. We also have senior advocates available to answer questions about resources, benefits, Social Security, Medicare, housing, you name it. They're here to help troubleshoot and answer questions. We run the Meals on Wheels program for Thousand Oaks and Newbury Park. And we've started some new services during COVID, including a volunteer grocery shopping program for seniors and an emergency food pantry. And we're just getting ready to start a new program called Think Fit. And this is an evidence-informed brain fitness program that will be run over the Zoom platform. And it is up on our website now. seniorconcerns.org. Under our program section, you can learn more and see if Think Fit might be a good fit for you. So before we get started, just a little housekeeping. If you move your cursor on your screen, you'll see on the bottom, there is a chat box, and anybody that has a question for me or any issues going on with the Zoom, please type it into the chat box so I can see and respond. Then you'll also see something called Q&A, and that's where you can type in any questions that you have for our speaker today, and she will make sure to answer your questions at the end of her presentation, but you don't have to wait. If that thought pops in your head, go ahead and type it in before you forget, and we can make sure to get to that question at the end. This presentation will be recorded. We have been recording all of our seminars, and they're available on our website. You just go to seniorconcerns.org. Under Events, there's a Seminar tab, and then you can see all of our past recorded seminars as well as register for any upcoming seminars. So this one will be available in just a couple of days. So now I'm excited to introduce our speaker today, Nancy Avatabule. You'll notice by her screen here that she's all the way in New York, and we're fortunate to have her here. We got to hear her speak for a program that the Alzheimer's Foundation of America was putting on, and we thought she was such a wonderful speaker, and this topic was so applicable to all of us. And suddenly, when we do things over Zoom, geography doesn't matter. So we can reach out to any topics, any speakers that we think are the best, no matter where they live. And we were so pleased that Nancy agreed to join us today all the way from New York City. So Nancy is the owner of Urban Elder Care and a founding partner of Home Care Match. Nancy is an LMSW, former researcher and aging life care manager. As a 6-year board member and 2018 president of the Aging Life Care Association, she has been featured on Thomson Reuters' The Business of Managing Old Age, has written for the Aging Life Care Association publications and the Journal of Aging Life Care, and has been quoted in Consumer Reports, US News and World Reports, Caring.com, and SeniorHomes.com. In 2006, she was honored with the Outstanding Chapter Member Award for the New York chapter. And in 2014, she became a fellow of the Leadership Academy. Nancy holds an MSW, a BFA, and a BA from the University of Connecticut. She has a postmaster's certificate in gerontology from the Brookdale Center of Healthy Aging, where she is now an instructor. She has a wonderful background in education, and we're happy that she's here today to present on creating a COVID-19 backup plan. So thank you, Nancy. I will turn it over to you.
Okay, thank you very much, Martha. And thank you to you and Andrea for inviting me to do this webinar. I'm very grateful, and it seemed like a lot of fun to do something at a distance. As you said, this is kind of part of the new normal. So thank you again. And just a little more background. I am in New York City. I have a geriatric care management practice, also known as an aging life care practice, where I have 4 other care managers, and we all work to support older adults, primarily living in the home. And I will say living at home since, January, February, March, till now, September, is definitely one of the preferred places to be. So I'm going to head out to my next slide. So thank you all for having me. So just a bit about the webinar goals. This isn't a lecture. We're not giving out CEUs, but, I did want to have a plan for the program. So I hope that you will all learn some of the essential elements of a coronavirus care plan. I will be speaking from the context of kind of my experience in New York City during our very unfortunate, very serious pandemic outbreak here. And of course, as an aging life care manager. However, I will try to relate it a bit. I mean, I understand, most people are driving cars there. So possibly, the subway is not, something that's going to be necessarily relevant. But, I will try to integrate as much as I can so we have kind of cross purposes here. So I did a webinar. Andrea and Martha saw this webinar a few months ago for Alzheimer's Foundation, and they had some prompts. So I'm not going to ask you to vote, but I am going to kind of ask you to think, how prepared do you feel about the pandemic? And then, it's just something to kind of reflect upon as we go through this webinar. I mean, you may say right now, well, you're very prepared. And then you find out, well, maybe not so much. And then someone will say, not at all. And then find out that actually they have a good amount of things already in place. So again, it's just something to consider as we go through the webinar. And I have a few more of those sprinkled through the material. So first, I just want to mention like contingency planning. We talk about contingency planning, we talk about emergency preparedness and care planning. And I have to say, for those of you who are care managers or providers, family members, caregivers, you hear that a lot. You hear that expression, care planning. And a lot of the elements of putting together kind of a family coronavirus plan are very similar to the elements we use in basic care planning. And I also want to say, in terms of this webinar, it's really going to be a continuum of kind of the very practical, use a mask, use a facial covering, to kind of getting into the spiritual, what matters most, how do we plan for end of life? And it's a lot. There's a lot of material here. And I will say that probably several of these topics could be hour-long topics on their own. Okay, so I'm just going to start with folks who are living alone. They may not have any caregiver, or maybe a couple, maybe 2 older adults living alone in the community together. And how do you access support? Now, some of you in California are living this currently. There's a shelter in place order, you're under quarantine. How are you going to access support? The other major issue that we're finding is combating isolation if you're alone. If you're alone without a support or with a couple, how are you getting your social needs met? Are you feeling isolated? How are you accessing medical care? Communications with loved ones. One thing that I mentioned through all of this is the importance of a needs assessment and to evaluate beforehand. So if there's a concern about a loved one living alone, I think it's very important to have some kind of evaluation. Senior Concerns, Martha mentioned that they provide consultation. I think that's very important because family members don't always know what's going on with an older adult relative. They sound great on the phone. They're managing, they're living alone. But as soon as things shut down, all of those routines are off. So one of the main things to ask yourself during these shelter in place times is, can someone drive? Who can do the shopping? Is someone well enough to do curbside pickup of groceries, for example? Do you have an Amazon Prime account so you can get your groceries delivered? In terms of isolation, what things have been put in place to focus on getting that socialization? A lot of people now have put in kind of newer platforms for communication, like we're doing now, but Facebook portals, different kinds of tablets that actually really give the person a kind of a face-to-face and a feel of being there right now with their loved ones and enhancing that communication. I have, and I am going to make a PDF of this presentation deck, so you'll have some of these resources. And also, I know Martha also mentioned having these brain stimulation programs. So we're going to see a lot more of that when we think about isolation and living alone. So I have the Hummingbird Project here, and also Sound Mind Inc. But you know, there are many more, and more are being developed every day. So again, just going back to living alone, have that needs assessment before you have to shelter in place. And I know hindsight is 20/20 because many of you are already sheltering in place, but get a sense of what's needed before we're cut off, essentially. Okay, I'm going to go to the next slide, but I do want to say one thing about medical care. As you know, all of the doctors, a lot of the physicians have moved into Zoom calls and FaceTime, and they're using, you know, HIPAA protected programs. Also, it's worth finding out if you can access any visiting physicians. We're very lucky in New York City. We have a lot of visiting physicians, many of whom take Medicare, and that has been very helpful during this shelter in place time. So I want to spend 1 minute talking about isolation. And you know, this is kind of going to be a little bit of a thread throughout because we'll be talking about residential settings and nursing homes. July 20th, a day before I did the Alzheimer's Foundation webinar, Betsy Morris in the Wall Street Journal wrote on isolating the elderly is bad for their health. And we have all seen this. Anecdotally, I can tell you, families who call me now, families that I've served for many years, will all say one thing, and I'm sure you've experienced it and you've heard it. My mom, my dad, my older adult relative, they just seem a lot worse. And nothing's really changed. They didn't get sick during the virus. They didn't have corona. They didn't even have a UTI. I would say many people stayed quite healthy. Some of the points in her article were that isolation, this concept of isolation being soul crushing. And that's, you know, going back to my whole notion of the practical and to the spiritual. Isolation is soul crushing. And we know that loneliness causes stress. We know that loneliness causes stress, and then therefore stress impairs the immune system. Humans in general are wired to be social. So again, terrific thing that Senior Concerns is doing with their brain stimulation, their brain fitness, and just that level of connection. Okay, next. I thought this was a very sweet anecdote from the Atlantic Monthly. They had an Instagram post of two older adults, and I think they may have been in New York City, but they were neighbors. And during the shutdown, they came up with a plan that they would actually interact daily. I'm not even sure they knew each other. I mean, you know, look, we live in buildings of 300 units, 400 units. You don't always know sometimes your neighbor on your floor. But these two had made a pact that they would communicate. And as you see here, they said they were going to have a plan that we would talk to each other every day. We always made sure we didn't call during Andrew Cuomo's press conference because we both had to watch that. but we would check on each other and see if we needed anything. And, you know, around this grew this shared bonding over mutual interests, and they share now a People magazine. Gold says, I think it's nice to be friendly with your neighbor, especially if you live alone like I do. I feel like I can call upon her. I can ask her something about my iPhone, my iPad, if I can't get a picture, et cetera, et cetera. And I just thought that was a very sweet anecdote. And also just a reminder, again, know your neighbors. You know, prior to this shutdown, we were living very crazy lives, very busy lives, rushing a lot, and you know, get to know your neighbor and get to know your contacts. You know, and I guess this is really my point here is just about connection. Find out who you can be connected to, in case things shut down. And again, I know you're living that now. Okay, so here's another prompt. Again, just something to think about. Is your loved one better off coming to live with you, with your, you know, an adult child, a relative, or staying in their own home? Again, just think about it. In their home, in my home, in either location, they'd be fine. Okay, so relocation. So we saw this a lot in New York. Adult children rushed in and took their parents out of the city. Upstate New York, wherever they were located, Florida, anywhere out of New York. A lot of people left New York. Now, going back to my first slide about the importance of a kind of assessment and evaluation and kind of getting a look at an older adult relative or parent or loved one kind of before a crisis hits, especially if you have a little inkling there might be something going on, whatever that may be, a little memory loss, maybe not eating well, and maybe a new health concern. So what we saw, you know, were a lot of adult children who whisked their parents away and then kind of discovered there was a lot more kind of decline than they even knew was happening with just general phone calls. So a couple of things. New routines, roles, planning. Okay, so you're living in the epicenter and you decide to stay. You decide to live it out. You know, you're going to stay in New York City. What kind of things are necessary? Buildings are putting limitations on individuals who can even come in the building. Nothing is being delivered to your door anymore. If you have food, it's brought down to the first floor. And if you're living in an apartment, you have to go down and retrieve your food. Non-essential workers unable to come into buildings, housekeepers unable to come into buildings. As you can imagine, nurses, home health aides, visiting physicians, visiting NPs were permitted into buildings. So, okay, that may be a good reason to bring your older adult relative out of the city. Find out what's going to be acceptable in the new regiment, whatever that is and whatever their location is. What kind of screenings are you going to have to undergo at the front desk when you try to visit? Will you be allowed to visit? One building in New York basically banned visitors, except for the home care workers. Okay, so you decide now you're going to relocate your parents to your home, and then you're finding out that they need more help than you had initially thought. Why is that? Well, they're living in their own home. They're accustomed to their own routines. They're accustomed to whatever kind of maybe jerry-rigged system they have going in terms of how they ambulate around the apartment, how they keep their food, whatever that may be. And now they're in a brand new place, maybe a great big gorgeous new house with a new bedroom, and it's really confusing. And they don't get around so well. We unfortunately had an adult daughter who decided to move her mom upstate, and she became so disoriented, so confused that she actually had to be hospitalized for, you know, a bit of a psychiatric incident. So that's kind of an extreme case, but again, weigh the odds. You know, are they better coming with me? Are they better staying at home? What services do they have in the current location that I can't provide? What can I do better? And again, as I said, the sudden realization that the needs are far greater than they had even imagined. Okay, and then there's the relocation to residential living. Okay, so we had a few clients who decided during the epidemic that they were going to move into a residential setting. And I think this is not uncommon. And essentially through March until now, I would say in my practice, I'm still getting calls from family members who wish to relocate to an assisted living or a residential setting closer to their children, maybe near friends. So what does that mean? So I think there's a number of questions that one might consider. And, you know, residential living can encapsulate memory care, assisted living, independent living, and of course, nursing home. Very important to ask about the infection rates, current infection rates. And, you know, just to digress a minute, it's so interesting to actually do this webinar now in September when New York is basically flat, and I hope it stays that way, knock on wood, and to think about the intensity of what we went through, you know, back in the spring. So, but it is still customary to ask about infection rates, ask about how residents are quarantined if they were to get an infection in the facility while living there. You want to ask about their admissions, their current admissions. Are individuals allowed to tour the facility now? Or do they have simply a virtual tour and then only the very serious get to come in for an in-person tour? Be prepared for nursing Zoom assessments. Nursing and social work Zoom assessments now have become the norm at this point. So your loved one, if they're thinking of transitioning or if you're thinking of making a transition to a residential setting, you will be assessed your physical functioning, your cognitive functioning on a Zoom call. It works, not always optimal. And sometimes in terms of the cognitive assessment, it can be a bit difficult for the person who's required to respond, the person who's being assessed and tested. Obviously, your medical assessments can come from your physician and from your, you know, medical chart. Be prepared. Moving companies are really busy right now. It's probably one of the most booming areas of the business or the economy, the economic sector. Very difficult to get moving companies. So if you are considering a move, think about timing. And you also have to time your COVID tests. Many facilities now, I will say, again, this is kind of new, many facilities are now testing on site, which is terrific. But that still can take a few days. If you want to move into a facility, they're usually requesting a 72-hour negative test. So, and they may want two. Before you're able to enter. So you have to think about timing. You have to consider the lab that you're using or the typically doctor's offices in hospitals here, you get 24-hour results. You can go to an urgent care and you won't have a result for 7 days, which really isn't going to do you any good in terms of the timing for a move. Integration and socialization. So going back to the slide on isolation and the importance of socialization, what happens, and is probably currently happening in California, although I don't know for sure, is that the residents end up moving into a place with all this wonderful socialization and they can't socialize because they have to stay in their rooms. So that was a big thing here. Individuals who had been accepted were to move in March, move in April, and they could still move in, but they were going to be isolated in their room. So they wouldn't have the benefit of meeting other people. They might have the benefit of seeing some staff members. So a lot of individuals put off that move until things loosened up a bit. So that is really something very serious to consider. It's like moving into you go to a hotel in a strange city and you're basically locked in the room, more or less, and someone delivers food to your door. So that's not always great for individuals with cognitive impairments, but also any of us. I mean, that's a big transition to move into a new environment when you're stuck in the room. So find out how, your loved one will be socialized, how will they integrate them into the facility given this new normal. Outside private assistance, always a big question. Currently, now we really have a very low infection rate here. Currently, facilities are now permitting some bedside companions. Hospitals are slowly permitting bedside companions, or a visiting aide or something like that, or even an advocate. For the first time, we have been able to go into memory care and assisted living for a brief time. We are not going into the patient's rooms. We are required to meet in the lobby at a distance for a short duration, 30 minutes. And we have to have routine COVID tests. And we can get them at these facilities. So that's kind of helpful. But these are all the questions that you need to ask. There's really a lot to think about. Okay, so nursing homes, subacute, nursing homes and other residential settings. So I kind of lump these together. So, okay, your family member has been hospitalized, something happened, maybe they fell during this period and they had to, maybe there was a slight hip fracture or something, or maybe someone had a stroke. These things were all happening during this crisis. And they did well in the hospital, now they're transitioning to subacute. I think it behooves everyone to really investigate the necessity of subacute versus transfer to home. I will say, and healthcare, if anything, this virus has shown all of us is healthcare and caregiving is easier when you have a lot of resources, or can be, I should say can be easier. It's never easy, but can be easier if you have resources to pay for it. If the subacute care can be kind of mirrored at home, think about bringing your loved one home instead to reduce kind of the risk of infection. Some people had done this and it was very successful. In the beginning of March, many of our clients, we had calls. The first 2 weeks of March, we were so busy because so many families were calling us because they wanted to move their parents home with home care. And the ones who had resources were able to do that. But it is something to think about. And I've had a lot of families kind of weighing those options. Do we spend home care dollars, or do we spend the money later if subacute turns private? Do we spend $300 a day, or this is New York City, so the rates may be, well, no, California and New York are probably similar. Or do we end up in subacute indefinitely and end up spending, $500 a day? So, you kind of have to weigh that. Also with the subacute in the nursing homes, things have changed here, but it was really bad. And I know you've all read about it in the paper. We had huge infection rates here and everywhere. I mean, adult care communities worldwide, right, had huge infection rates and a great deal of deaths. So again, what are the new protocols? What are the new policies? Okay, can everyone see the slides? I just want to be sure. I got some funny message just came up. We're good? Okay, all right. So again, maintaining contact, limiting isolation. For those of you who have not experienced the new kind of nursing home protocols, if your loved one does need to enter a subacute, find out immediately how you can maintain contact. Typically, the nursing directors, the social workers, recreation are scheduling FaceTime calls, tablet calls with loved ones. They're very brief. They're trying to do this for everyone in the facility. Sometimes you get an appointment every other week. It can be very frustrating. If the the individual in subacute can use a tablet, I encourage you to have them bring one in, bring a cell phone if they can do that. Accessing real-time information is really, difficult and is still extremely difficult. I encourage families to continuously ask for care plan meetings with the entire team, and if you need to, have an advocate on the phone for that care planning meeting so someone can ask the questions. Because you'll get a lot of information thrown at you, but in that information, there's kind of other information, more nuanced information that an advocate can certainly, help you kind of decipher. Outside visits, can you meet in the courtyard? Are you able to take your loved one to a park if there's a face covering in your masks? Something to consider. I love this, a room with a view. Usually a room with a view is like a room with like an amazing view, right? Of valleys and mountains and whatever. Now a room with a view is first floor with a window. And if you are able to, and here of course we have 14, 15, 20-story buildings. Our nursing homes are set up that way. If you live in an area where it's all kind of on the first level, then you're lucky. Ask for a room, with a window, so you can actually do visits that way. And ask about on-site testing, which we had discussed in the last slide. Oh, and one other thing, ask about updates. If you have a loved one in a facility, or they might have to go to a facility temporarily, what type of daily updates will you be receiving on the infection rate, the number of people tested positive, staff and patients alike? Okay, now we're going to move to the home care workers. And I love this question because so few people think about it. And even now, when I'm getting calls about having a home care worker, or will my home care worker stay, I always ask the family, well, did you ask them yet? And they hadn't. So if you have a home care worker, for those of you who do have home care workers or are thinking about having a home care worker, have you asked the home care worker whether they would stay if your loved one contracted the virus? Yes, no, I don't know, maybe doesn't really work, but yes or no. So home care. So I will say one very positive thing about my practice is we don't work with a lot of individuals who live in long-term care facilities, be that assisted living, retirement living, or nursing home. So we kind of battened down the hatches by looking, so we had shelter in place, right? Shelter in place happened. And the first thing we did was we just simplified the amount of people going into the home. And unfortunately, that did mean a lot of home care workers were cut. So we had a lot of private home care workers were furloughed. Agency home care workers, if there was excess workers, they were cut. And that was a complicated, really complicated and difficult decision to make in many cases. Usually, we looked at seniority, but we had home care workers, and this is still going on. I have a home care worker who has been, I think she had one break, who has been sheltering in from March until today. So March until beginning of September. I have met other individuals who have also been doing the same thing. We had our workers immediately shelter in place. We cut care managers, my staff. We did not go see our clients unless it was absolutely essential and they were alone. They didn't have a caregiver, they didn't have a family member. We eliminated all the split shifts, so that eliminates the coming and going. We eliminated physical therapists, we eliminated housekeepers, and you'll hear me kind of go through this as we go through the slides. We have pretty strict laws here for private home care in New York State. I'm proud of that. I know California has the same very strict laws about overtime and workers' comp and domestic workers' rights. Obviously, it's very important to observe the federal and state employment laws when you are furloughing your private home care workers. All of our private home care workers are all payroll employees, so they are all on payroll, they're household employees. And fortunately, there was a bit of a softening in some of the laws. our home, a lot of people got unemployment, which was really terrific. But also we were kind of permitted to have a worker work 7 days, kind of work indefinitely. Typically, you know, it isn't permitted for a worker to work 7 days. So that worked to our advantage in this case. Transportation of your worker. Now, I'm going to make the assumption that many of the home care workers and family members and supportive people visiting the home in California are probably using their own cars. They're using their private transportation, which we know is safer. Many workers have come off the subways. They're using Ubers. They're using a private car service, something like that, to get to work, to protect themselves, to protect the family. Oh, and I already talked about this, the other supports, the care managers, the physical therapist, everyone was eliminated from the home. And of course, facial coverings for anyone entering the home. And, you know, as a reminder, I mean, you're all living at home currently. The person who comes in to fix your cable box, or, you know, you have a plumber or some kind of household need, make sure that person is wearing a mask. I had to turn away many kind of, I don't even want to say emergency, but equipment repair people because they weren't wearing masks. How they were able to get through the building, I have no idea. But you know, that's another thing to remember. And then communication. So going back to my first question, would your home care workers stay? So much of this planning is about communication with the workers, all workers, the agency workers, the private workers, because you know everyone is scared, right? This affects them as well. I mean, and we know our home care workers are very devoted, but you know they're fearful as well. They're fearful for their families. They're fearful about bringing a virus to their client. And I think it's very important to communicate with the workers, make your workers feel supported, you know, understand their perspective on what's going on, and you know how they feel about kind of if they were to get infected, or if someone, you know, if their patient were to get infected. I can't stress that enough about communication. And also, you know, one thing that happened here, which was a bit of the uglier side of the pandemic, a result of the pandemic and all the fear, was, you know, family members' assumptions about home care workers. You know, where did they live? We don't really know much about that worker, do we? Who do they go home to? And, you know, I found that unfortunate. And of course, but we know where that was motivated by just this overall fear. But these are workers who had been in their home for 7 years or 5 years or 2 years, you know, and that's why I say communicate, you know, get to know your employees. I'm not suggesting become friends with them. Boundaries are important, but there are things that we can now think about when we think about our workers and their needs. Okay, this is one of those slides that could be an entire discussion. Part of your planning must include your advanced directives. Again, this goes for regular care planning in normal times, but these documents really should be in order. And coronavirus has given everyone a perfect excuse to bring this up and to initiate this discussion with their family members. Many of you already, I'm sure, have attended many webinars on the subject. Healthcare proxy basically is an agent nominated by an individual to make decisions about their healthcare in the event that they cannot. A living will is a document where you express your own wishes for end-of-life decision-making. A power of attorney is an individual you appoint as your agent over your property. And the most, and it may be a pulse in California. Yeah, okay, so here it's medical orders for life-sustaining treatment, which is, you know, again, is a portable document from community to hospital to nursing home that will guide your providers on decisions about treatment. And I think all of these really need to be in place now. And we're going to get to it in a moment, but one's desire for for if they were to get infected and how they would access treatment and what they would want should be part of this discussion, even in a living will. Okay, very basic. I was going to touch on the practical, and you know this already. You want to have your medical supplies, enough food for a few weeks. Although, I don't know how relevant that is. We didn't really have the vast disruption to our supply chain that was predicted, but I still have been encouraging my workers as we move into fall to start stocking up again. Many of them have closets full of PPE and, extra medications and things like that. So everybody's already kind of thinking about it, and I really hope we don't go there. But, as you all know, and again, I don't know how it is in California, but I'm going to make the assumption that, the minute you walk into a CVS and a supermarket now, the masks, the sanitizer, the bleach, everything is up front. You can get everything, get it now. Prepare that way. So I'm just going to kind of summarize again some of the kind of questions that you want to discuss with your family members. And then I'm going to go on to a little bit of the kind of decision-making questions about end of life, and then a bit on reopening, and then I'll conclude. And how am I doing for time? Am I okay? I have no clock here, so okay. It's going to take a sip.
Yeah, you're doing fabulous. You have about 15 minutes, so
okay.
Maybe leave a couple minutes for questions. Thank you.
Okay, great. So, thank you. So just to summarize, and you will have this PowerPoint so you can revisit it, see where you stand on your preparation. But so asking yourself, what if your family member is infected? What will you do? We're going to get to a slide on that in a little while. What are your practical arrangements? Food, pulse oximeter? Do you have a working thermometer? Do you have Tylenol? We couldn't get Tylenol. I couldn't get Tylenol or rubbing alcohol for at least 6 weeks. What are your plans for quarantine and isolation? Yeah, I probably should have mentioned that in the home care slide, but if your loved one does come down with corona, how will you isolate them in your home, and how will they be cared for? I think that's an enormous kind of question, especially for the couples, husband and wife, who are kind of caring for each other, or a spousal caregiver. And if you don't have any support in the home, how are you going to handle that? And I will say the CDC has really great guidelines for dealing with someone who has to be quarantined in the home. Home care, again, do they stay? Do they go? Who goes? What do they think? Ask the home care workers their opinion. Hospitalization versus home hospice. This is another thing to think about if your family member were to become infected. As we know, a lot of individuals with comorbidity and older adults have higher risk factors for more serious reactions to coronavirus. And I will say, we didn't have anyone go to the hospital. Not one person was hospitalized. To this day, I probably still have in my practice 7 individuals who are under hospice care. They're all doing great, but they were sick enough to be home in need of hospice care. Not all of them had coronavirus, only 2. And they're still with us, miraculously. And again, just communication. Communication, what are the expectations? What are your expectations? What are the person in need, your loved one's expectations, home care? Ask the question. Okay, so here, if you became very sick with COVID, would you prefer to stay home, to stay where you live, or go to a hospital? Again, think about it. Staying home, stay home with monitoring, go to a hospital. There's many other choices as well, I suppose. I don't have hospice on there. Again, just something to kind of think about. Here's a resource. I'm sure many of you have heard of the Conversation Project. they really have a nice form here, a discussion tool, a COVID discussion tool. And this is a really good time to think about who you want to be your decision maker and think about what matters. What matters? Does it, you know, I mean, and we could go into a number of examples. Does it matter to you to get every possible intervention in a hospital? Or do you want to just be at home and quiet? And if your situation, you know, takes a turn for the worse, do you just simply want to have palliative care in your home? What if you become seriously ill? And they also have another article here, Time to Talk About Death. You know, you can explore the Conversation Project and some of their articles. I think this is a really great organization, and they have really great tools for initiating the discussion that don't really feel awkward. So, you know, we had to talk to families early on. You know, we had several clients with severe chronic obstructive pulmonary disorder, you know, high risk. And basically what would happen if they did get infected with the virus. I will say many of my clients' family members would have opted for palliative care. Some of the physician practices, although they stopped this, were actually prescribing kind of a comfort pack. So it would be there in the home, even if the patient wasn't on a hospice program, you know, which included things like morphine and, you know, other benzodiazepine kind of medications. Now, I will say that's how it started, and within a few weeks, they changed protocol on that, which was probably a good idea. And many of our individuals who were very sick were able to get hospice care. And everything was brought into the home, the hospital beds, the oxygen, any kind of supplies that were necessary, medications, etc. Everything got brought into the home. And one of the most convenient things for me was using visiting practitioners. If you have them in California and Southern California, identify them now, because they really were the saving grace of our practice. So just going through kind of rehearsals. This is part of the communication. And you can do this frequently. Contingency planning with your home care team. Who gets the first call if someone's infected? And I'm talking also about an aide, you know, the aide is infected. What happens then? Understanding end-of-life responses of authorities. This is different state by state. If your family member dies in the home and they're not on a hospice program, there's a certain protocol to follow. Here in New York, we must call 911 unless they're in hospice. We must call 911. We can't simply call the funeral home and have them transport the body. 911 comes in and they have to investigate. And it's usually very simple, but that is the protocol here. Do you have your deeds and contracts with cemeteries ready, funeral homes, communities of faith, your rabbi, your priest? Have you had these discussions? Have you put these things in order? Again, this is a really good time to do it. Most hospice programs offer pastoral visits. You don't need to be on hospice to have pastoral counseling and pastoral visits. And then who is responsible for remains immediately following the death? What are your state laws for controlling the disposition of the remains? You know, who's going to track, who's going to, you know, confirm. I mean, this is not uplifting material, but this is all the stuff that you're going to need in that 11th hour if there is a crisis. Okay, well, this is a good question for coronavirus planning and in general. If you are caring for someone who is ill or near the end of their life, do you have a burial plan? Yes or no, or in the process of preparing? It's probably a really good thing to have ready at the moment, and knowing who to call, where things are located, what's been paid for, because doing it in the crisis period it is extraordinarily unpleasant and overwhelming. Okay, so let's go to uplifting now. Let's reposition to reopening. So these are new slides. And what is safe? So I'm again doing this from New York. I'm sure California will get there. hopefully soon. So check your local COVID websites, you know, local health department, CDC. I have to say, I love the New York Times site because they really codify the information. It's very visual, it's very immediate, and I can get what I need. So, you know, I kind of check every day. I really have been checking the rates. So what's changed since March 2020? Well, a lot. In the past 7 days, there were 1,981 infections. Okay, not too bad. You know, I look at the line, I look at where we're staying flat, and I'm checking that essentially every day. And what are the numbers telling us? You know, again, it's informing this our soft opening, you know, when we can go to the next level, but it's also informing us whether or not, you know, your family member can go outside for dinner, um, or your aides can take public transportation again, and of course can go outside for maybe socially distanced visits with relatives. I'm almost done. Um, and evaluate activities. Okay, so now, you know, a lot of family members are asking me, can I visit my mother? Should I visit my mother in the house? I have one daughter who hasn't seen her father since March. She has not gone up into his assisted living. She has not gone to see him. They've seen each other through the window. And I think for the first time on his birthday yesterday, he turned 98, and they went out to dinner at an outside restaurant. It's the first time since March. So evaluate what you'd like to do, right? Your time. Think about time. You don't want to spend too much time with others, but you can have visits in short duration. Space. Seek situations where space can be maintained. People, the fewer the better, as we know. And the place these days is outdoors. You guys are lucky. You live in Southern California. At least you can be outdoors most of the year. And then running essential errands. You know, try to do everything as remotely as possible. Banking, shopping, grocery store, you know, socializing. We do think the cloth coverings work. They certainly do think that at the CDC. Our state has been really strict on facial coverings. We can't go anywhere without them. I can't leave. I live in an apartment. Personally, I can't leave my front door and go into the hallway without wearing a mask. There's restrictions on public transportation, on entering a drugstore, grocery stores. Everyone is required to wear facial coverings. And then, of course, using hand sanitizer immediately if you have to touch ATMs, door handles, elevators. We have to remember that this isn't gone, even though, well, here it feels better. We're not hearing sirens 24/7, but we still have to maintain these protocols. Okay, 2 more and I'm done. Provider responsibility. And if there are any providers on the call, just, you know, we're doing this in my practice. Are you helping or are you risk taking? Do you have to see that patient? Yes, if you're a private provider and you make your livelihood that way, maybe you think so. But I think it's very important for all providers to think about what's essential and what isn't. You know, there should be always routine temperature checks, routine evaluations. What about the MD office entourage where there's a care manager, there's an aide, there's an adult daughter, and maybe a spouse at the visit? No more of that. Things can be done by phone easily, email, phone. What about emergency departments, hospital visits, even home visits? You know, do we need to be in there every week? What about the other system efficiencies that are available to us? So that's just my kind of last slide to providers, if there are any on the call, or if you employ providers, you know, how do you want to work with them in the future during this kind of virus period? And where can they cut back but still be as efficient? I have PTs doing Zoom physical therapy now, and it's working well. Okay, final slide, and then we'll do questions. So Corona felt, and I think for some people still going through it, still feels like a wild card in an already potentially complex environment, right? Caregiving is complex. You're working with a client system, you're working with illness and a lack of predictability. And now we have this in the mix, which is so random. Um, we now have more information about the virus, and we will continue to do so, which is a very positive thing. And then I'll just conclude with, um, communication, planning, and knowledge are key. And that concludes my presentation. So thank you.
Well,
I'd
thank
love
you.
to
Oh my
take
goodness. It's so much information, and I really appreciate you being willing to share the slides so I can email them to everybody after. I just wanted to mention locally, looking for our local numbers and information, you can go to vcemergency.com, should be something everybody bookmarks for all your emergency information in Ventura County. And then if you click on the coronavirus icon, it takes you to venturacountynumbers.org. And that lists every day, they repost what the daily numbers are for our county, and all the stay-at-home orders and pertinent information. And you can also sign up to get emails with any updates that they have. So I would definitely recommend that. We just have a couple of questions. One person noticed earlier in your slides when you were talking about social isolation, you mentioned Sound Minds Inc. and the Hummingbird Project. And would you just tell us briefly what those are and what, there's the concept that there's so much available now is wonderful.
Sure. I'm not as familiar with Sound Mind. Hummingbird Project is actually based in Northern California. And it's a recreational program and done currently via Zoom, via, kind of virtual interaction. And it's like kind of an art recreation program, but they have all sorts of engagement, anywhere from, a discussion on art history, or a tour around a favorite locale, Switzerland, or let's tour Florence. I can give you so many examples, from, card playing to music, and they have really expanded across the country since the coronavirus. And SoundMind Inc., I believe, is more of a communication tool where you can set up for immediate calls to family members. And you're doing your brain fitness program, which is similar to these two. And there's another one in New York, and I'm not sure they've expanded yet, called Mind Sense, where they're also offering art engagement, any type of recreational engagement, and also fitness and exercise.
I do love seeing all the new technology and ways that we're creating programming over the internet. I mean, in person is better in many ways, but a lot of people were having trouble accessing in-person things anyway, because of transportation or other geographic barriers. So I think it's nice, and I hope some of that does continue to stay, because it does make things more accessible from home. Then we have a question that said, any suggestions for interacting with all of the other neighbors in an apartment complex who are hostile to the idea of wearing masks when going outside, like when to pick up mail at a mailbox or in the laundry room?
It's a great question. And gosh, I think that is the question of the pandemic. I don't know if your building has a building manager. I mean, really, that's where it all starts. And with the building manager, and with the, again, with whatever the state kind of has mandated, or the county, we cannot, again, I don't know what they have in your building, but if someone isn't wearing a mask in our building, there could be potentially a fine to our, our maintenance fee. So, confrontation is problematic, and I don't suggest that. I think the best thing to do is look at any supporting material, or what the state or county has put out in terms of requirements. And post it in the laundry room, post it around your building. I'm sorry, that's awful.
Absolutely.
And scary.
Yes, thank you so much. I did want to mention that Senior Concerns has created a document about creating your own backup plan that really, excuse me, acts like a checklist with all of these things to think about. And it looks like this, super cute. And so this is now available on our website as something that you can download. If you go to the seniorconcerns.org website, there is under programs, a tab for COVID-19 programming. And that's where you can find this and also our COVID toolkit booklet and some other great information, and also links to VC Emergency and important websites. But what I'll do is after this seminar, I will go ahead and email all of you that attended this document as well as Nancy's slides so that you'll have everything for you. And our next seminar will be 2 weeks from today on September 22nd, and that is about the legalities of hiring in-home care. And so we have a lawyer who's presenting that, and we'll talk about not just hiring somebody through an agency, but what about if you hire somebody privately? What legal aspects do you need to know about? And we'll also touch on things that you need to think about now hiring in-home care during the coronavirus pandemic. So you can go on our website and register now for that. And I want to just again really thank Nancy for sharing your time with us all the way from New York. This is such valuable information. There's so much there for all of us to think about. I know it's gotten me thinking. We've had some workers in our house lately, and I even ordered those disposable booties to keep so that I can offer that if they don't bring them to cover their shoes when they come in the home. And you kind of don't think of these things until it happens and you're in an uncomfortable situation thinking you're bringing, you know, all your germs inside. So this is really helpful for everybody to think through. The more that we think ahead and plan, the easier it will be if we do have to experience a crisis in the future. So thank you. I see somebody has just typed in to thank you for your excellent presentation. We really appreciate it, and I hope that you all have a wonderful evening. So thank you. Oh, and if anyone has a question they didn't get to, please feel free to email me because I'm happy to pass it along to Nancy. We want to be here for you and get all the information out. So again, thank you and good night, everybody.
Thank you. Night.